Hello and welcome to QOF 400 Screencasts. In this episode, we'll be discussing chronic heart disease template. Using our test patient, we will establish the fact that this person or patient suffers with chronic heart disease by launching this particular template. As you can see, this is among the busier templates than the usual just because of the breadth of diagnostic codes it covers. These include, as you can see, ischemic heart diseases, angina, myocardial infarction, and so on. Assuming that this person suffers with angina, let's say stable angina, we can choose our appropriate code, and then if we decided that this person needs to be referred to a specialist, then we can go ahead and establish this little fact by saying we are referring him to a cardiologist. Furthermore, if we have the opportunity to measure their blood pressure, we can go ahead and measure it and enter it here. If, of course, as you can see, if he or she smokes, then we can choose the appropriate code and advise them not to if they are smokers. At this juncture, then you are reminded of the basics of management for chronic heart diseases by applying beta blockers, antiplatelets, or anticoagulants for that matter. And for those who suffered with myocardial infarction, they need to be on an ACE inhibitor and statin in addition to the other two. Of course, the rest of the prompts are only there to remind you of what needs to be done for these patients. Somewhat less known fact is the depression screening for those who suffer with chronic diseases such as CHD. You are here reminded of these two questions that you need to ask of your patient. Assuming the patient said no to both questions, then you can just say you have screened them, and you can add a little fact to say no evidence of depression, and that would satisfy your requirements. On the other hand, if he or she answers yes to either of the two questions, then you need to go ahead and assess them fully for depression using other tools such as patient health questionnaire number 9 and so on. Furthermore, you can proceed to the other tabs as appropriate. And again, as you can see, this is a quite busy template, but as I said before, it's only because of the breadth of the areas it covers. Here, for those who are interested, you have a reminder of what CHD looks for in these patients. I hope this was a helpful and useful reminder for management of CHD. Thank you.